Dr. Kim Nichols here, board certified dermatologist at NicholsMD of Greenwich in Greenwich, Connecticut. We have our beautiful patient here today who's never done lip filler, and this is very exciting. She's very excited because we're going to do the NicholsMD signature liquid lip lift today, which is going to give her a subtle and beautiful pout to enhance her already gorgeous lips. Her shape is already beautiful. This is just going to give her a little bit of enhancement. What I'm going to use is a combination of Juvederm, which is my favorite filler to give lips a little bit more pout, and also just a few units of Botox right in this upper lip area just to give a little bit of what we call lip. All right, so now we're going to begin. So I'm using that few units of Botox I talked about for the kind of the little lip flip of the upper lip. And I'm going to be injecting it as you see. So just a little pinch right in the vermilion border, which is right here, just at the top of the vermilion border, right near the Cupid's bow. And that's going to give her a lovely little flip. Probably take about a week to fully set in, but it will actually go in pretty quick. And sometimes I do that just alone on patients who maybe don't need filler or already have filler or don't want filler, and that can give a little subtle enhancement of the upper pout. All right, so now we're going to switch to the Juvederm for the filling. And what I like about Juvederm, it's going to give a subtle pout, a little bit of volume there, but not going to make it too much, as it were, or too ducky. I know that's something that people are scared of. And I happen to use insulin syringes, so I put the Juvederm into very small needles to make it more comfortable for the patient, of course, and also to make the risk of bruising less. So we're going to start. I like to do this in quadrants. So we'll call this the upper right quadrant. And again, you'll see I'm going to be doing a number of small little micro injections into the vermilion itself, which is the lip. How you doing?
Good.
The red of the lip. And now I like to come and do the bottom quadrant of the same side before I move on to the rest of the lip. I can have you part your lips a little bit, even a little bit more like open. Yes, perfect. And now I'm going to go right into that wet, dry border of the lip, or the white-red borders, another way of describing it. And again, see how subtle this is. I'm going to do a little massage as I go along. This is really going to be pretty. I can already see some pretty pout there. And now I'm going to go to the other side and start with the lower lip, that next quadrant, and on the side. Beautiful. Gorgeous. And then I'm going to come around and I'll do this quadrant. So pout for me a little bit more. Good. And again, that wet, dry border. And the rest of this quadrant. And you see I'm just using these micro doses. She's already got gorgeous lips, so she's not going to need a ton in terms of the filler itself. I often will always bring patients back, especially newbies like this one, for a quick, what we call kind of a quick follow-up in about a week or so once everything is set in. And now I'm just doing some what I call airbrushing of little areas that I want to address for continuity and symmetry. Good. Beautiful. And what I love about her lip, if you see here on the camera, is she's already naturally got this perfect, what we call the balance of the 1/3 to 2/3. So I know it's in fashion, but lips, upper and lower lip should not be the same size. The upper lip should be about 1/3 smaller, and you can see that she already had that to begin with, and with the enhancement with the liquid lip lift, we've maintained that proportion, just giving her a little bit more of that beautiful, sexy volume. Massaging the area, which we'll do, and get out any lumps and bumps. Now, in terms of what you should notice over the next several hours, she'll notice that you're going to have some swelling, which is normal and to be expected. We also ask you that you don't drink any hot liquids probably for the next few hours because you still have some of that numbing lidocaine in there, which is in the filler, which helps with the injections. And then even by tomorrow morning, the swelling should be down by about 50%, if not more, and definitely within 48 hours that should be done. And then we'll make your follow-up appointment about a week to see how everything looks.
Thank you.
Awesome. So please let us know any questions that you guys might have about the NicholsMD Signature Liquid Lip Lift. It's an amazing procedure, and you also see how quick it is, and it's done really in less than 10 minutes.